Dr.Earle. We're here at Pure Plastic Surgery today, and it's Hump Day with Dr.Earle. As you guys know, this is the time I get to spend with you guys, answer a whole bunch of your questions regarding really any plastic surgery topic, or even about myself or my background or anything else. So I'm happy to answer all that. And today I wanted to touch on a subject that I know kind of irks sometimes, the surgery community. Sometimes, we'll put this like incredible post, this before and after, say like a BBL or mommy makeover, and you'll always get somebody who writes, you should just exercise, right? You should have done abs, or you should have done squats. And of course, a lot of people jump on there and defend the decision. And it's really, honestly, it's someone who's not really understanding what's happening. It's really kind of an asinine type of comment, because a lot of the results that we're able to achieve with surgery are just basically impossible to achieve with exercise alone. Now, that's not to put down exercise. I think exercise is important. And actually, you get the best results when you combine everything, right? When you combine surgery with exercise and the appropriate diet. That's when you get those really kind of amazing results. Okay, so you want to do all three things. Nothing is a substitute for another. So surgery is not a substitute for healthy diet and an exercise program. Okay, but it can definitely get you to a point where you would never be able to get to with just diet and exercise. And then if you want to maintain those results and you want to enhance the results, then you continue with the diet and exercise program to really maximize the results in terms of just overall and also how long they last. Okay, but let's kind of delve into that a little bit. So let's talk to those people that are like, you should have just done planks and the problem would have gone away. All right, so yes, exercise is important. Of course, it's important for your health, for your fitness level. It's important to tone your muscles. Okay, and of course it makes you feel better. When you exercise, you release endorphins. Okay, we know that. So you feel better after you do exercise. You feel healthier, and overall it prolongs longevity. Right, you live longer if you exercise. There's been multiple studies out there that show that people that have that even just walk, say once or twice a day, have longer lives than those that are completely sedentary or spend most of their day sitting. So all those things are true. So I'm not knocking exercise in that sense. I think exercise is very, very important for all of these things. And then, like I just said, to maintain your surgical results. But let's look at some things where exercise and diet and exercise they're just not going to help you. So, for example, pretty much any breast surgery. Of course, exercise has to do with tone and muscle. So it's not going to affect something that's basically not a muscle. Okay, so there's no way to exercise enough to get to augment the breast. And if you lose a lot of weight, then the breasts are going to become ptotic, and exercise is not going to affect that at all. So pretty much for anything that's related to the breast, exercise is not going to help you there. And I think it's fairly obvious. It's pretty straightforward. How about loose skin? You can't tone loose skin. You can tone muscle. You can tone the muscle underneath the loose skin. Okay, but exercise is not going to help. Especially like moderate to excessive loose skin contract. Okay, so if you had a few pregnancies, okay, where you had, the belly kind of expanded, the skin got stretched, and then, you've had the babies and you've done, maybe 2 or 3, you've had 2 or 3 pregnancies, that skin that's down here, that's not going to get better with, doing sit-ups or planks. Okay, nothing's going to be able to help that skin. Same thing if you actually underwent bariatric surgery and you had massive weight loss. You lost, any 80, 100 pounds, 120 pounds. Okay, a lot of times, when that happens, you have loose skin in the belly area, you have loose skin in the arms, sometimes loose skin in the neck or in the thigh area. And of course, exercise is not going to be able to help that. The only way to get rid of loose skin, especially when it's kind of moderate to excessive, is to remove it. Okay, is to cut it out. And that's why you have all these body contouring surgeries, such as your tummy tuck, your brachioplasty, your thighplasty. Okay, so it's not going to help you with loose skin. The other thing that people always, a lot of women don't like are their hip dips. Okay, So their hips they're not rounded, they actually kind of dip in, so a little bit, concave instead of convex, okay? And so women don't like the hip dips, and they want to kind of plump that out to have, nicer curves in the area. Actually, exercise will not, there's no amount of squats that you can do or exercise you can do that's going to fix hip dips, because actually it will potentially even make it worse. The leaner you become, the more kind of squats that you do and things of that nature, that could actually accentuate a hip dip as opposed to filling out a hip dip. So what you need to fill out a hip dip is actually fat. You need some fat in that specific area to kind of pop it out, to round it out. So you need more fat, not less fat, okay? And so exercise will never fix a hip dip. The only way to fix a hip dip is with fat transfer, okay? And then of course, in terms of, it all depends, I wrote here curves, but it depends on kind of what look you're going for, okay? So if you see out there, men and women, but we're talking about women here specifically, women that are very, very thin, or very, very fit, they do tend to be a little bit more kind of squarish, a bit more rectangular. It's a different type of look. If you have a very kind of defined abdomen, so you have your abs that are defined, but your obliques are defined. When you have defined obliques, that makes it less of a hourglass figure, okay, and it makes it a little bit more of kind of a straight figure into here as you go into the waist and then the hips, okay. So this is all about this time. This is about preference. What type of look do you like? So if you really like that kind of like hourglass shape, then it is actually better to not have such like very well defined abs and obliques, okay, and to actually have a little bit of fat in the areas that you need it, and to take away fat in the areas that you don't. And that's where something like a BBL comes in, right? Because you're combining liposuction with fat transfer. So if you remove the fat for the areas that you don't want it, and you place it in the areas that you do, you'll end up with a much more of an hourglass type of shape, okay? And that's why I've always said that the ideal BMI, so the ideal BMI for a BBL is somewhere between, say, 24 to 27 or so, somewhere in that range, okay? Once you get, and the lowest BMI that I do for a BBL is 22, and once you kind of get below that range, you're not a great candidate for a BBL because you just don't have that much fat in you to be able to transfer. So the lower limit is about 22. This is probably the ideal range here, and then in my practice, the max is 33.5. 33.5 would be the max in terms of a BBL. Okay, so, and then of course, like I said, the best thing is to combine all three. So after your recovery, you resume exercise, you have surgery, and then very, very important is your diet, okay? And I know last time I promised we were gonna try to get a nutritionist on here, and we're still looking. So if there's a nutritionist out there who actually also specializes in like post-surgical type of nutrition, we'd love to hear from you. Please send us a DM. We'd love to have you here on Hump Day so that we can educate our patients, okay? But diet is extremely important. You want to maintain a healthy diet. If you're doing something like a fat transfer procedure, you want to initially be on a diet where it's high in what we call the healthy fats. This includes things such as avocado, salmon, certain nuts, as well as milk products, such as you can enjoy your milkshakes and your ice cream as well. And of course, after BBL, you don't want to be losing weight. You want to kind of be either maintaining your weight or maybe even gaining a little bit of weight in those first 6 weeks while the fat cells live in order to maximize your results. Okay? All right, so I hope that explains a few things, but I'll be happy to answer questions.
Can you provide a vixen look with a BBL or a skinny BBL?
So I can do either. So I try to tailor the procedures, to the patient and kind of what their foundation is and what their desires are. But in terms of the vixen look, so the skinny BBL, I think that's easier. Like I said, so we can go as low as a BMI of 22, and that's a fairly low BMI for BBL, but that's a great, we can definitely get started there and do the skinny BBL and certainly change the shape. Now, in terms of the vixen look, I do get this question a lot. Can you provide a vixen look? So I can, within the kind of the confines of what is appropriate and what is safe. Okay. So as you know, here in Florida, we do have a max of, in terms of how much fat we can remove via liposuction, and that's 4 liters. Okay. And I follow those those guidelines, because those guidelines are there for a reason. It's for your safety. Okay. So so the max is 4 liters, and that's the maximum that I'm allowed to remove, and that's the maximum that will be removed. So if you're someone that's on the higher end of the spectrum here, you probably have more than 4 liters, and you may have to come back for a second round. Okay. The other thing is, for those kind of really exaggerated looks where there's a lot of projection. Those looks were popular a few years ago, but remember, a few years ago, we didn't know as much, and it was actually almost encouraged to place fat into and under the muscle, right? And so when you're placing a lot of fat into and under the muscle, then you can have those really drastic, very projected looks, but it's not safe. Okay, we've learned. We got to go. We've learned throughout the years. We know that that's not where you want to be. That's dangerous, because deep to those muscles are those superior and inferior gluteal vessels. And if you injure those vessels and fat gets in there, then you're going to get a fat embolus, which can lead to very serious consequences and even death, right? So we've learned from that. We know that we don't want to be in that layer, so we want to be in the layer between the muscle and the skin. And so now we don't have as many compartments that we're able to fill in one go. And so then what really becomes the rate limiting step is skin stretch, all right, or skin elasticity. And so you can only push so much fat there until the skin just won't stretch anymore, and that's as far as you can go, okay? So if you want to have those really kind of drastic vixen looks, nowadays, if you do it with a surgeon that's safe, such as myself, a surgeon that's that uses the ultrasound for the fat transfer, that makes sure that the fat's being placed in the right location, it is quite possible that you may need to do more than 1 round.
How long do I have to feed the fat for?
Great. So the most important time to feed the fat is for the first 6 weeks. Okay. So the first 6 weeks after surgery is kind of the kind of crunch time, and during that time, you definitely want to be feeding the fat. You definitely don't want to be losing any weight. But I've seen results actually continue to improve and continue to be enhanced if people remain on that kind of feed the fat diet up to the about 3 to 4 month mark. So if you can continue up till then, even better. And then I remember that after 6 weeks is when you can start exercising again. So if you do the surgery, you feed the fat, you continue with that type of diet up to the 3 to 4 month mark. At 6 weeks, you start exercising. That's when I've really seen like some truly fantastic results.
If I lose weight after the BBL, will I lose the new fat?
It's quite possible. Yeah. So and it can be at any time. I mean, if you lose weight immediately after, then less cells are going to live. So that kind of becomes a permanent issue, right? Less of the cells that were transferred will live. So instead of, say, losing the average, which is about 30% fat loss, you may have a 50% fat loss, okay? But say you don't do that, say you feed the fat, you do okay, but then, 6 months down the road, you lose 20 or 30 pounds. Well, you're gonna lose fat there too, okay? I talked about this a little bit the other day, okay? Fat in an adult, fat cells, the number of fat cells in an adult don't really change, okay? There is some slight change because we have stem cells, etc. But basically in a nutshell, the number of fat cells don't change, okay? But what changes is the size of the fat cell. So when someone gets fat, their fat cells become bigger, okay? And so when we do a fat transfer procedure, we're removing fat cells from an area where we don't want them, and we're placing them in an area where we do want them, okay? And so, say we're transferring it from the waist area to the buttock area. Now, if you gain weight, then you're gonna have more fat cells in the buttock area. So when you gain weight, you're gonna gain more weight in the butt because those fat cells are gonna grow, okay? And you're gonna gain less weight in the waist because you have less fat cells there to grow. But if you lose weight, you're gonna lose weight. The fat cells are gonna shrink everywhere. They're going to shrink wherever you have them. So yes, it is quite possible that you'll lose volume in the buttock if you lose a significant amount of weight. The good news is that those fat cells are still there. So if you gain the weight back, you should be able to gain it back.
Is surgery the only way to fix loose skin?
For significant loose skin, yes. Okay, so if you have what I would call mild excess skin, then there's less invasive ways of improving that. One of them is the body tight, which we have here. So we talk about that a lot. That's basically a skin tightening procedure that uses radio frequency type energy. Okay, RF energy we call it. And that can be used for more mild cases, okay? It works extremely well a lot of times in the chin and neck area when someone has kind of like a mild to moderate case, we can avoid a much bigger surgery such as, say, a neck lift, okay? And it also works pretty well for the arms, okay? So mild to moderate cases for the arms, you can do body tight there, and then you avoid that kind of long, very visible arm lift or brachioplasty scar. Now, but if you get to the point where it's kind of moderate to severe, okay? Unfortunately, really the only way to deal with that is with skin excision, basically removing the skin. And those are all those are your surgical procedures that you've kind of heard of regarding body contouring, okay? That's your arm lift, your tummy tuck, your thigh lift, your neck and face lift.
I know you have quite a few patients who want a tummy tuck and a BBL. How do you determine which one's first?
Right, so for the most part, we don't do those procedures together, again, because here in the state of Florida, the Department of Health tells us that if we're doing a tummy tuck, we can remove only 1 liter of fat via liposuction. That's actually quite clearly written there. So we tend to separate out the procedures so you can have the best result kind of from each one, okay? How do we determine which one we do first? Has to do mostly with the degree of skin laxity. So if you have pretty severe skin laxity because say you had a bariatric procedure, you lost 100 pounds, then for those patients, I typically prefer to do the tummy tuck first. And then they ask, well, what about the fat, in that skin? Am I going to lose? For the most part, that fat is not really significant enough that it's going to make a difference for the BBL later, okay? So when the skin is like really kind of hanging loose, it's best to tighten up that area first and start with the tummy tuck. Now, if it's anything less than that, okay, if you have just some mild skin laxity or some moderate skin laxity, then the thinking is reversed, right? Then in that case, the BBL is best to do first, because I've been quite surprised that in some patients, they do get a fair amount of skin retraction and then they end up not wanting or needing the tummy tuck afterwards. Okay, that part's a little bit unpredictable. It's hard. I can't really tell all the time by just looking at someone whether they're going to be able to have their a good amount of skin retraction or not. It depends a lot on the quality of that skin. I've done a whole talk on skin elasticity, and I really encourage everyone to go and see that. But if you have skin that's kind of an older patient, you have skin that's someone that's a smoker, or a past smoker, because we don't operate on that, active smokers, but a past smoker, or someone who has a lot of stretch marks, then we know that for the most part that's poor quality skin and it has less of a chance of retracting.
So what if you get a patient that's cleared for surgery, you've evaluated them, and their surgery, let's say, is in a couple months, and they lose weight when they see you the day before surgery? Does that affect results or your evaluation?
Well, it could potentially affect results, and depending on how much weight is lost, and it could potentially affect the order of how we do things. Say, for example, when I first evaluate you and I see your photos and everything else, we say we're going to do a BBL, but then for whatever reason you lost like 30 pounds since then, and you come in and you have a lot of loose skin, then we may say, well, let's switch things around. Let's start with that tummy tuck today, and then come back for the BBL for the second stage. So is it possible? Yeah, it's possible, but for the most part, it would have to be a really significant change in order to completely have to change the plan.
Can I still vape a non-nicotine smoke juice prior to surgery?
You have to be absolutely sure that it doesn't have nicotine, okay? I've seen some of those that say they have 0 nicotine, but then there's like a little kind of asterisk and it says it may contain some nicotine, which is, I don't know how that works. But I've had patients swear to me that they were vaping the one that had supposedly no nicotine, and then we do the urine test and it's positive. Okay, so I'm not sure how you make absolutely sure that it doesn't have nicotine, but maybe you do like a home urine nicotine test and make sure that that's negative. But here's the thing: if you come and the nicotine is positive, we're gonna have to cancel the surgery, and that's really gonna be very, very painful for you and for us. So if you can stay away from vaping altogether, that would probably be the best bet.
What is the recovery time frame for a BBL lipo? When should you start moving, going to work, and then working out?
Right. So one of the key numbers to remember after that is basically 6 weeks. Okay, because pretty much everything happens at 6 weeks. Okay. All right. So for the first 6 weeks, okay, you can't do any heavy lifting or strenuous activity. That means no gym. Okay. Also, you should try to avoid sexual activity as well. You can't do any swimming or submerging the body under water. So only shower for the first 6 weeks. Okay. You can't do any just regular sitting on the buttock. You got to use that BBL pillow during that time. Okay. And then of course you're going to be wearing your faja night and day for the first 6 weeks. Okay. After 6 weeks, then you can start to be more active. You can do exercise, you can do swimming, you can submerge the body in the water, bathtub, jacuzzi is okay, sexual activity is okay, and sitting, importantly, sitting is okay. So sitting and also sleeping, sleeping face up is okay at that time as well. And then in terms of the faja, you're going to scale down on that faja to about 12 hours a day. And then you're going to do that with the faja until you get to about the 3 to 4 month mark.
How long do you have to wait to get a BBL after you've had a gastric sleeve?
So there's basically a couple of criteria. It's not gonna, so certainly there's a time criteria. It's not gonna be before 6 months. Okay, so you need at least 6 months. But that's not the only criteria. You have to make sure that your weight is stable. Okay, because if you're still in that kind of downward losing weight loss track, then it's not a good time to do a BBL procedure. Okay, you want to make sure that the weight has stabilized. Okay, so typically it takes about 6 months, but in about 6 months you're going to lose weight rapidly, and then you're going to stabilize. And then once you're on this kind of flattened end of the curve for a couple months in here, okay, 2 months of stable weight, then you can go ahead and get your procedure.
Is it true that you do not gain weight in the areas that were lipoed?
So I just kind of talked about this a little bit. It's yes and no. Okay. What is true is that you've permanently removed the number of fat cells in the areas that have been lipoed. Okay, permanently, because your body does not duplicate or regrow fat cells for the most part. A little bit it does, but for the most part it doesn't. Okay, but the fat cells that are left behind, okay, because you can't remove every single fat cell. Okay, obviously that's physically impossible. So there are some fat cells that are left behind, and those fat cells can grow if you gain a lot of weight, right? So like we said at the very beginning, surgery is best when combined with diet and exercise. It's certainly not just a complete substitute for diet and exercise. So if you want to have the best long-term results, you want to do all three, okay? But if you just do liposuction and then don't care at all about surgery and exercise, and about diet and exercise, and just continue to pack on the calories, you're going to ruin those results, guaranteed. They're going to get ruined. You're going to gain some weight in the areas of your lipo. You're going to gain weight in other areas, and the worst area to gain weight in. And let's talk about this a little bit, because it's also very important. I'm going to make like a very crude kind of drawing here. Okay. But this is the skin, okay? This is your muscle, your abdominal wall, and this is where the organs are, okay? Intestines, liver, stomach, everything else. All right? What happens when you gain weight after liposuction is the fat cells start growing in other areas, and you start gaining what we call visceral fat. Okay? Visceral fat is the fat that's deep it's within the abdominal cavity where the organs are, okay? And there is no surgical solution for visceral fat, okay? There's no surgery that we can do that's gonna help that. The only way to reduce visceral fat is with diet and exercise, okay? So when you do liposuction, you're hitting at this fat here between the skin and the abdominal wall, okay? But you can't, there's no way of getting into this fat here. You wouldn't want to get into that fat anyways. That's where all your vital structures and organs are, okay? So yes, you do not want to gain significant amounts of weight of liposuction. The way that your body gains weight may be different from before, and you may gain a significant amount of visceral fat, and that just makes your belly kind of pop out, and that just doesn't, you know, and it looks like kind of like a permanent kind of pregnant type of state, and you don't want that.
How do you prevent dog ears from a tummy tuck?
Right. So what you have to do to prevent a dog ear from the tummy tuck is to go as far back as you need to go to make that smooth. So I know sometimes that's competing, because some patients are like, well, I don't really want, you know, I want to make the incision as short as possible, but I also don't want dog ears. And those things go against each other, okay? Because if you need to remove some more skin and you have to go around the corner, and then, you know, around the corner towards the back in order to prevent a dog ear, then that's what you have to do, okay? So, and then what determines that factor really is the amount of loose skin that there is, and you know, how far back it goes, basically. So, but really, so to answer, that was kind of a long-winded answer, but to answer the question, you go as far back as you need to try to prevent that dog ear, and then you do also combine it with some liposuction to that kind of flank waist area, to also reduce, you know, the volume in that area to try to prevent a dog ear as well.
And staying on the mommy makeover topic, do you add Lipo 360 with a mommy makeover? And
no.
Oh.
All right. So again, if when you're doing a mommy makeover, the typical mommy makeover is a breast procedure and a tummy tuck. Okay. And so again, you're limited to the 1 liter of fat removal when you do those procedures, and so.
Do you do any lipo with a mommy makeover?
Yeah, and so then you're only able to do basically lipo to the flanks and the waist area. Sometimes you can add some other kind of smaller areas, okay, if you're not going to reach that 1,000 cc limit just with the flanks and the waist. So, you know, we can add sometimes, say like the chin or arms, and for those particular patients. But, you know, that's the limit. And in terms of Lipo 360, really for the overwhelming majority of patients, that's going to require a lot more than 1,000 cc's of fat removal. And so we don't combine the Lipo 360 with the mommy makeover.
So for patients on the smaller side, let's say a patient with a BMI of 19, could they put a deposit down and then gain weight?
Sure. Yeah, you can certainly do that. When you have your BMI is 19, you're trying to get to that 22, you definitely can go ahead and put your deposit down and try to lock in your rate and then start to gain weight. What we try to avoid is if the BMI is like way too high, right? So if your BMI is, say for example 38, if your BMI is 38, we want you to really kind of get down to much closer to our max BMI before you're able to kind of put in the deposit and lock in your rate, okay? The reason we do that is because we would hate to have to like cancel your surgery last minute because you weren't able to meet your BMI requirement, okay? And like I said, the max BMI is 33.5. So if you are able to lower that BMI from say a 38 down to 34, then around then that's okay. We know that you don't have that much more to go, that you're going to be able to achieve that, and then it's okay to go ahead and place your deposit at that time.
Do you do buccal fat removal? Can you add that to a surgery?
So actually I don't do buccal fat removal, and I have a few reasons why. But so what is buccal fat removal? So buccal fat removal is basically removing the fat from kind of this kind of cheek area here, okay? So there's really no liposuction procedure that we do to the face. So there's too many important structures there. Importantly, something called the facial nerve, which is what allows you to move what we call the mimetic or the motor muscles of the face, right? So you don't really do liposuction into kind of, say for example, the cheek area. So instead of doing that, you can do what's called a direct excision of the buccal fat, and typically the approach is actually through the inside of the mouth. Okay, so that's what buccal fat removal is. Now, why I don't like that procedure? Because while it may enhance the look a little bit when you're young, say when you're like 20 or so, it's really going to be detrimental once you start to get older. So what happens as the face starts to age is that it starts to actually lose tone and lose fat, and then everything starts to fall and everything starts to sag. And so I think when you have buccal fat removal, especially if it was too aggressive, then you will have an aged look much sooner than you should or you would have otherwise.
Can you add body tight with a BBL?
Yes, so body tight we can add, and we can, there's different areas that we can focus on with the body tight, but the two most common areas that we add body tight are the chin and neck area. In that case we call it face tight, but it's similar machine, just a smaller cannula. And I think that works awesome. I would probably recommend face tight for anyone that needs or wants chin or neck liposuction. I think it really enhances the results. And then the other area that is fairly common for the body tight is the arms. Okay, again, because if you have some degree of skin laxity and you do lipo alone, and that skin doesn't have a chance to retract, then you're just gonna end up with like a kind of empty, floppy skin, and that's not a great look. And then on the flip side, a lot of people don't want to do that arm lift because it's like kind of a very visible, long scar that tends to end up wide and sometimes become hypertrophic or keloid. So the best kind of solution to that is to use the body tight, because in that sense, then you can do the lipo, you can remove the fat, you can use the body tight to tighten up the skin, and you achieve a much nicer contour of the arms with less risk of kind of floppy or hanging skin.
Thank you. Can you lipo the buffalo hump?
Yeah, we can certainly do that as well.
The buffalo hump on the back of the neck.
Yeah, and that is considered an additional area. That's what we call the kind of the upper back. And so if you wanted to do that, we could do it as an additional area. But yeah, the buffalo hump is kind of right back in here, and we can reduce that if someone needs it.
Let's see, we have some great questions.
All right.
Is there anything you can do for stretch marks?
Oh, stretch marks. So stretch marks are tough. Here at Pure, I don't really have any lasers or anything else that we can do for them. But a lot of times, if you're talking about stretch marks in the belly, it's usually related also with loose skin, and so they get removed with the tummy tuck. Okay, so most of the stretch marks tend to be underneath the belly button area, and so when you do the tummy tuck and you remove all that excess skin, a lot of those stretch marks are going away with it.
Can you do anything for cellulite?
So cellulite is a tough problem, and unfortunately there isn't a great solution out there. Whoever finally comes up with it, I tell you, that's going to be gangbusters. But there is no great solution. There's some people use Selfina. They say it works okay. In terms of fat transfer, so I've seen many different things. So I've seen a good amount of patients where the cellulite of the buttock area does improve. Okay, I've seen also a fair amount of patients where it looks pretty much the same, and then I've seen very few, and it's unfortunate. It's very few. I would say probably 1% or so. But I've seen a few patients where it actually looked a little bit worse after the BBL. So a little bit hard to predict. I think for the most part it'll either look similar or a little bit better after the BBL.
Can you give a little bit of info for patients that have MS and are interested in a BBL?
So we don't do MS here in the outpatient kind of in our clinic here at Pure. The reason being because it is a little bit uncertain as to how you're gonna wake up from the anesthesia, whether that's going to be prolonged or not. And we certainly can't, we don't keep patients overnight here at Pure. So if you have MS, then the option really becomes to try to do it in the hospital setting.
So for patients who vape marijuana, is that okay before surgery?
Yeah, so actually THC and CBD is okay. Actually the bad guy is nicotine, so make sure that the wraps that you're using or whatever else is not laced with nicotine, and as long as that's okay, as long as when we do that urine test all we see is a THC, then you're good to go. That's not a problem. We can continue and go ahead with the surgery. So what are the things, so let's kind of delve into that a little bit. So what are the things that are okay? So THC is okay. Benzodiazepines, so things such as Xanax, Ativan, those are okay. We can continue with surgery with those. Some of the pain medications, if you have to be on them for whatever reason, that's okay. So you have, like morphine on board or anything like that, we can still go ahead and do the surgery. We just have to talk to your doctor as to what kind of a pain management plan or regimen you're going to need after surgery. But it won't cause you to cancel the surgery. What are the things that are not okay? Certainly, pretty much do not pass go, do not collect $200, you will not get your surgery today, are amphetamines, okay? And what's the one that's most common in our patient population? Phentermine. Phentermine, you gotta stop phentermine 30 days before surgery, okay? Because if you have phentermine in your bloodstream, which shows up as an amphetamine, we have to cancel your surgery. The other thing that shows up as amphetamines are the drugs for ADHD, okay, such as Ritalin. All right, so again, that's why there you're gonna have to talk to your psychologist or psychiatrist who are taking care of you to see what can be done. But we can't have anything that resembles amphetamine in your bloodstream for surgery. Cocaine is an absolute no-go. Okay, if cocaine shows up, that's it. You're canceled. There's way too risky. You can have a massive heart attack and pretty much die on the table. So we don't mess around with that at all.
When getting an implant exchange, do you do incision by areola?
If we're doing an implant exchange, I try to use whatever incision you had before, so as not to create a new scar. So whatever the first surgeon used, we can use that. So if it was a periareolar scar, then we can use that one. Mm-hmm.
How many days post-op do you recommend your out-of-state patients to stay in Miami?
Okay, so for all procedures, you have to stay here 5 days, okay? 5 days post-op minimum, okay? All right, and what's day number one? Day number one is the day after surgery. So surgery day is not day number one. Day number one is the day after surgery, okay? And then you can leave preferably in the afternoon on the 5th day, okay? Why is that? Because we want to prevent the potential for DVTs and PEs, that's deep vein thrombosis and pulmonary embolus, okay? So in order to try to minimize that risk, you gotta stay here a minimum of 5 days before you then hop on a plane and fly back home.
Can you do local instead of general for lipo?
If the question is in kind of globally, there are surgeons that do that. If the question is for me specifically, I don't, okay? I use general anesthesia for all my major liposuction cases. I only do local if it's like a very, very small area, so you can say like maybe just the chin or just touching up something real quick. But for the most part, I use general anesthesia. I do that for, again, a couple reasons. So one is because when you use general anesthesia, you don't have to use lidocaine in your tumescent solution, okay? And so therefore, that is all safer for the patient because there is zero risk of any lidocaine toxicity, okay? So that's one of the reasons why I use the general anesthesia. And then the other reason is because of patient comfort. So I know the patient is completely asleep. I know the patient is not feeling any pain. And so I'm able to do the procedure and not have to worry about that. Also, there's no moving, no squirming or things of that nature. So I think overall I can be a little bit more aggressive and overall it's a little bit also more comfortable and safer for the patient as well.
All right, we've exceeded your time. I know we have to go soon for the last question.
All right.
What kind of dog is Roxy?
Oh, all right, nice. Okay, Roxy's an Australian Shepherd. She's awesome. She's great. She's an Australian Shepherd, and when they have that kind of color pattern, they call that a blue merle. So she's a blue merle Australian Shepherd with different color eyes. That's right.
Thank you.
All right, everybody. Okay, well, I hope this was very helpful here today. I hope we answered a lot of those questions about can you just work out and get certain results, and I think it's quite obvious that for certain things you cannot, and that's where surgery comes in. But I do want to reiterate that the best outcomes are when you combine all three. When you combine surgery with a diet and exercise program to achieve the best results and maintain those results. Okay, guys, so we will hopefully maybe get some DMs in there regarding the nutritionist, because I really want to get one here so we can have some education regarding that topic. And as soon as we do, maybe we can set up for either next week or the following. All right? Okay, everybody. Well, it's been great. And I will see you all next week for Hump Day with Dr. Alex Earle. Ciao.